Have you ever wondered what keeps our blood vessels flexible and strong, allowing blood to flow smoothly throughout our bodies? It is a remarkable system, finely tuned to adapt to constant pressure and change. But what happens when that flexibility is lost and the vessel walls become stiff and rigid? Fibrosis in blood vessel walls is primarily caused by an excessive accumulation of extracellular matrix proteins, predominantly collagen, in response to chronic injury or inflammation. This process leads to the thickening and stiffening of the vessel walls, impairing their elasticity and function. It is a critical component in the development and progression of various cardiovascular diseases, including arteriosclerosis. The underlying mechanism for this harmful buildup often begins with damage to the endothelium, which is the inner lining of the blood vessels. This damage can be initiated by various factors, such as sustained high blood pressure, elevated levels of low-density lipoprotein cholesterol, high blood sugar from diabetes, or exposure to toxins from smoking. When the endothelium is injured, it triggers an inflammatory response. Smooth muscle cells within the vessel wall, and sometimes specialized fibroblasts, are then activated and transform into myofibroblasts. These activated cells are responsible for overproducing and depositing collagen and other structural proteins, leading to the characteristic fibrous scar tissue. Understanding these triggers allows us to appreciate the importance of managing risk factors that contribute to vascular damage. For instance, maintaining healthy blood pressure levels, controlling blood sugar, and adopting a balanced diet can significantly reduce the chronic stress on your vessel walls. Regular physical activity also promotes endothelial health, helping to prevent the initial injury cascade. By proactively addressing these factors, we can minimize the inflammatory signals that drive fibrotic changes. A key concept to remember here is the dynamic interplay between remodeling and repair. In healthy vessels, there is a balance between matrix synthesis and degradation, allowing for normal tissue turnover. However, in conditions leading to fibrosis, this balance is skewed. Enzymes like matrix metalloproteinases, or MMPs, which normally break down old matrix components, become dysregulated, while the production of new matrix material accelerates unchecked. This imbalance is often exacerbated by cytokines and growth factors, such as transforming growth factor beta, or TGF-beta, which potently stimulate fibroblast activity and collagen synthesis. Ultimately, the sustained health of your blood vessels relies on preventing the chronic inflammation and injury that instigate this fibrotic process. By supporting your endothelial health and mitigating systemic stressors, you are actively preserving the natural elasticity and integrity of your circulatory system. This proactive approach helps ensure your body's vital supply lines remain as open and efficient, supporting overall well-being and longevity.